What parents and carers need to know about early years providers, in the autumn term. Returning to nursery, childminders. Children attending nurseries and childminders were able to return from 1st of June. From 20 July, nurseries were able to return to their normal group sizes. The prevalence of coronavirus, COVID-19, has decreased since schools and colleges restricted their opening to most pupils in March. The NHS test and trace system is up and running, and we understand more about the measures that need to be in place to create safer environments. The scientific evidence shows that coronavirus, COVID-19, presents a much lower risk to children than adults of becoming severely ill. There is no evidence that children transmit the disease any more than adults. However, there will still be risks while coronavirus, COVID-19, remains in the community. To manage the risks, things will be a bit different when children and young people return to education. We have asked nurseries, childminders, to put in place a range of protective measures to help reduce the risks. Your child's nursery and childminders will be able to give you more information about the changes they have made. Attendance. Attendance at nursery and childminders. Whether your child attends nursery, a childminder or another early years provider is your decision, but we do encourage you to take up a place for your child. Attending childcare can help provide a routine as young children develop their social skills. You can check if your child is eligible for any of the free childcare entitlements on the Childcare Choices website. These are worth on average £2,500 a year to parents of 2-year-olds and up to £5,000 a year to parents of 3 and 4-year-olds. Local authorities and schools have a range of legal powers to enforce attendance if a child or young person misses school without a valid reason. Helping make nurseries, childminders, as safe as possible. Each nursery and childminder will do their own health and safety risk assessment as part of their planning for the autumn term. As part of this, there are certain approaches that we have asked nurseries and childminders to implement that are essential to reduce health risks. Actions that nurseries and childminders will take. We have asked nurseries and childminders to manage confirmed cases of coronavirus, COVID-19, in line with current public health guidance. This means your child may be asked to self-isolate for 14 days by their nursery, childminder, based on advice from their local health protection teams, if they have been in close, face-to-face contact with someone who has tested positive for the virus. Ensure that everyone cleans their hands more often than usual, including when they arrive, when they return from breaks, and before and after eating. This should be done for 20 seconds with soap and running water or hand sanitizer. Promote the catch it, bin it, kill it approach, to ensure good respiratory hygiene. Enhance cleaning, including cleaning frequently touched surfaces more often. Nurseries and childminders will also minimize contact between individuals where they can. This could mean using different rooms for different age groups and keeping those groups apart. We know that younger children may not be able to maintain social distancing. It is likely that for younger children the emphasis will be on separating groups, and for older children, it will be on distancing. Actions you can take. Do not send your child to their nursery, childminder to are showing coronavirus, COVID-19, symptoms. Someone in their household is showing symptoms. Arrange a test if you or your child develops symptoms. Inform your nursery, childminder, school or college of the results. If the test is positive, follow guidance for households with possible or confirmed coronavirus, COVID-19, infection, and engage with the NHS test and trace process. It is really important that you help nurseries, childminders, to implement these actions by following the advice set out here and wider public health advice and guidance. Face coverings. Based on current evidence, Public Health England does not recommend the use of face coverings in nurseries, childminders, schools or colleges, except in some specific circumstances. This is because Children, young people and staff are mixing in consistent groups. Not using them correctly may accidentally increase the risk of transmitting the virus. There may be negative effects on communications and therefore on your child's education. The guidance on face coverings will be kept under review. Arriving and leaving nursery and childminder. Some nurseries, to stagger or adjust start and finish times. This helps keep groups apart as they arrive and leave the premises. Your nursery and childminders will be in touch to set out any changes they are making. This might also include new processes for drop-off and collection. Children and young people, and their parents and carers must not travel to nursery and childminders if they or a member of their household has symptoms of coronavirus, COVID-19.